Good day. My name is Dr. Marcus St. John. I'm an interventional and general cardiologist here at Baptist Hospital in Miami. And we're going to talk a little bit about heart disease and women with a focus on some of the risk factors that you might be faced, particularly in the Caribbean. Heart disease, when we use that term, refers primarily to the buildup of narrowings in the blood vessels that bring blood to the heart. These blood vessels are called coronary arteries. And when we talk about heart disease, we're really talking about cholesterol plaques. A plaque is a buildup of cholesterol and inflammation and tissue that ultimately can obstruct the flow of blood to the heart, and that can lead to symptoms, or it can also lead to heart attacks. And the important thing to remember here is that the same types of problems that can affect the arteries to the heart, the blood vessels to the heart, can also affect the blood vessels to the brain. So very often the same types of problems that lead to heart disease can also lead to stroke. And that's why it's a very important topic and one that really everyone in the Caribbean and the world in general should be attuned to, because it's very much a disease of the way that we eat and the way that we live. So let's talk a little bit about what some of the presentations of heart disease might be, how you might know that you're having problems, and then after that we'll talk a little bit about the risk factors. What are the things that we do that affect our likelihood of having trouble with our heart or our brain? So the typical manifestations of heart disease are pain or pressure in the chest, very often related to exertion. It can also be shortness of breath. It can be a sensation of an irregular heartbeat, and sometimes other types of symptoms like fluid retention in the legs or trouble breathing at night. Those are the typical manifestations. For women and heart disease, sometimes there are atypical features that are more common in women and a little bit more easy to confuse with other things. So very often a woman may not get the usual pressure in the chest when she walks, but she may just feel more fatigued than usual, or she may have abdominal pain that she thinks is indigestion, or simply not have the energy that she used to. So it's very important for women and for healthcare professionals to be attuned to the different presentations of heart disease in women than men, because too often women get overlooked. And part of the reason is that women and men and physicians very often still think of heart disease as a man's problem, and it is definitely not a man's problem. In fact, heart disease is the leading cause of death in women, both in the Caribbean but also in the United States, and it's responsible for the death of 1 in 3 women, much more than breast cancer, which is generally quoted at 1 in 8 or 1 in 9 women. So very often women are more concerned about breast cancer, which is an important disease, and you ought to get screened properly for it. But definitely you need to focus on heart disease if you're a woman. So let's talk a little bit about the risk factors. So what is a risk factor? A risk factor is any characteristic. It could be a lifestyle characteristic. It could be a blood test number that increases the likelihood of having heart disease or stroke. The main risk factors for heart disease are cigarette smoking, diabetes, so high blood sugar, high blood pressure, high cholesterol, and a family history of heart disease or stroke. And then another big risk factor is if you've already had a heart attack or stroke, you're at increased risk for having another one. And then there are some other risk factors that probably have their role by contributing to some of the other ones that we mentioned, that specifically being a poor diet and a sedentary lifestyle and being overweight. Taken together, those are the things that we need to work on to reduce our risk. Now, as you would have seen, some of those things we cannot change. So you can't change your family history, and one of the ones I didn't mention is just age. So getting older is also a very big risk factor. So you can't change your family history and you can't prevent getting old, but you can work on a lot of the other things, and that's really where we're going to focus some of our attention on in the next few minutes as we talk about some of these things. So let's talk a little bit about high blood pressure, and then maybe we'll go down each of these risk factors a little bit one by one, and then see if we can get a better understanding of heart disease and stroke. So high blood pressure refers to a blood pressure reading that is greater than 140/90. So for those of you who don't know what blood pressure is, it's really the pressure of blood as it flows through the blood vessels. It's typically measured in the arm in the office. Your doctor may measure one or both arms. The top number is the systolic number, and the bottom number is the diastolic number. So that systolic number, that top number, is the force of blood when the heart squeezes, and that diastolic number, that bottom number, is the force of the heart when it relaxes, or the pressure in the blood vessels when it relaxes. In general, a low blood pressure is better than a higher blood pressure. So a normal blood pressure, many people ask me, what is a normal blood pressure, doc? So 120/80 or less is optimal. We say that you have high blood pressure when it is 140/90 or greater. So either the top or the bottom or both is higher than it should be. One of the big things that contributes to high blood pressure, especially in the Caribbean, is a diet that is too high in salt. So sodium encourages the kidneys to hold on to fluid, and that fluid puts more stress on the blood pressure, and the blood pressure goes up. So one of the key things to treating blood pressure is really to work on your diet and to try to keep your sodium intake as low as possible. Very often for black populations who are more salt sensitive than others, we try to keep that amount of salt below 1,500 milligrams. Now most of us aren't going around thinking about what 1,500 milligrams is, but it's less than a teaspoon of salt in 24 hours, which is probably more than many of us have at any one meal. And one of the ways to really work on your sodium intake is to start by not adding salt at the table and in your cooking, but also to learn how to read the backs of packages and labels of things. So food that is more processed when you get it is going to have more salt than food that you prepare fresh or that you buy fresh and then prepare at home. So processed foods is a big source of salt, as is fast food or any restaurant food. And avoiding eating out, certainly avoiding fast food and avoiding processed foods, is a very important step that all of us need to take to try to lower our sodium content in the diet. So for most people, most of the salt that you get in your diet is more than just what you add at the table. But for many people, that's a very good place to start. And the research would show that most people can train their taste buds not to like that salt, usually in about 3 or 4 weeks. So you can do it. I think many people think they can't do it, but you definitely can. The other thing that's important for high blood pressure is to limit your alcohol consumption. So for an average weight man, generally limiting your alcohol intake to no more than 1 or 2 drinks per day. For an average weight woman, that might be 1 drink a day, because excessive alcohol use can increase the blood pressure. Trying to keep your diet high in fruits and vegetables is good for the blood pressure, and it also has a lot of other benefits in terms of weight control and being beneficial for cholesterol and those types of things. Regular exercise is another very important aspect of treating blood pressure. So we encourage people to strive for 30 minutes of aerobic activity most days of the week. So most days means 5 or more, but if you get 3, that's better than 0. If you get 6, that's better than 5, and so on. And it doesn't have to be anything fancy. If you have access to a beach and you live fairly close, then walking on the sand for 30 minutes. If that isn't the case, but you have tennis shoes or sneakers, then you can walk around the block. Wherever is safe and convenient, and someplace that you will do it frequently. For a lot of people, doing it with friends or with at least one other person to help keep you motivated is a good idea. So exercise and weight loss, but even exercise without weight loss is good for the heart and is good for your blood pressure. So those are the types of things that you need to think about if your doctor tells you that you have high blood pressure. But more importantly, to prevent the onset of high blood pressure, because it is a very common thing in the Caribbean and in the Western world, and it is a big cause of stroke and perhaps one of the leading causes of kidney disease, and it's one of the main reasons why people end up on dialysis. So there are lots of things that blood pressure can cause, and that's why we refer to it as the silent killer, because there are usually not any symptoms to high blood pressure, especially if it is not extremely high, but it can really wear away at your blood vessels in your kidneys, in your heart, in your brain, and other vital organs. So I think now let's turn and talk a little bit about high cholesterol, which is another very common risk factor for problems with the blood vessels. High cholesterol, Well, let's start by just saying what is cholesterol. So cholesterol is a substance that's necessary for the body. It's a vital part of cell membranes. So cholesterol has a role in the body. The problem is that in most Western countries we get far too much cholesterol. When your doctor or your healthcare professional does a cholesterol panel on you, they will usually give you about 4 numbers. One is the total cholesterol. One is the LDL, which is the bad cholesterol. So the LDL, you want to keep that as low as possible. So one of the ways to try to remember that is L is for low. You want your LDL as low as possible. The LDL, more than anything, is the substance that builds up in heart arteries, in brain arteries, and neck arteries, and slowly but surely obstructs the flow of blood. So it's the cornerstone of diseases of the heart arteries and of the brain, and what we call atherosclerosis or plaque. The HDL is the good cholesterol, so the H is for high. You want the HDL as good as it can be, or as high as it can be. The HDL scavenges cholesterol from those arteries, brings it to the liver for excretion. And the other part of the cholesterol panel that your doctor will measure is the triglycerides, which are a type of fat in the bloodstream. And the triglycerides very often can be high in people who are overweight, people who have diabetes, people who have abdominal obesity, and people who eat a high-fat diet. And of all the cholesterol numbers, it's the one that seems to be the most responsive, even to just minor changes in the diet. So what if your doctor tells you you have high cholesterol? There are a number of things that you can start doing right away to try to lower that. And many of them, as you'll hear, are very similar to the things that you can do for high blood pressure. And a lot of these risk factors share a lot of features in common. But for the high cholesterol, you really want to start working not just on the high cholesterol part of your diet, but things that are high in saturated fat. So very often animal products are the biggest culprit. And I know we sometimes like a lot of meat in our diet in the Caribbean, and that's a source, I think, of a lot of cholesterol in many people's diets. It's not to say that you can't eat meat, but you have to start cutting back on that, especially the red meat. You want to make that the occasional part of your food, not an everyday, and try to replace some of that red meat with fish. So we encourage people to eat fish twice a week. And if you are a meat person, then try to transition to skinless chicken or turkey. Again, avoiding processed forms of those foods so you're not getting too much salt as well. A diet high in fruits and vegetables, again, very important. Avoiding fried foods. So we also have this tendency to frying a lot of our foods, and that is a big source of saturated fat, which becomes a big source of triglycerides and bad cholesterol. Baked products, especially if you're baking them or buying them from the store where they've been sitting on the shelf, they have in them very often, although regulations are starting to change that, but they have in them a lot of things called partially hydrogenated oils, which are rich in a very particularly bad type of fat called trans fat. So learning to read the label. The problem with trans fat is that it lowers your good cholesterol, so it drags down that HDL, and it also raises your bad cholesterol, so it does the worst possible thing for your cholesterol numbers. And while we're talking about sweet things, too much unrefined sugar does a number of things that is bad for your cholesterol. So it also lowers your HDL. It contributes to an elevated triglyceride, and then it also adds to weight. And very often we start to gain weight first in our abdomen, which leads to insulin resistance, which is a precursor to diabetes, and it leads to elevated triglycerides. So working hard on all these aspects of your diet is a first step to treating high cholesterol. And there are a number of things that you can do proactively. So keeping your diet high in fiber, things like oatmeal are good for lowering the cholesterol if you like it, but just fruits and vegetables. Again, walking and exercise will improve both your weight and your good cholesterol and raise the HDL.